Hello everyone! Today we're diving deep into understanding HIV/AIDS. It's a topic that's often surrounded by misinformation and stigma, but we're here to break through that and provide you with clear, accurate information. Over the next few minutes, we'll journey together to understand what HIV/AIDS is, how it's transmitted, and the advances in treatment and prevention. We'll delve into the science, explore the history, and discuss the human impact of this global health challenge. Our goal is to empower you with knowledge, because knowledge is the first step towards understanding, compassion, and ultimately, prevention. So, let's begin. Before we go any further, let's clarify what HIV and AIDS actually mean. HIV stands for Human Immunodeficiency Virus. This virus, as its name suggests, attacks the body's immune system, specifically the CD4 cells, also known as T cells, which are crucial for fighting off infections. Now, AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of HIV infection. It's important to note that not everyone with HIV will develop AIDS. With proper treatment and care, people with HIV can live long and healthy lives. Early on, HIV might not show any noticeable symptoms, or it might mimic common illnesses like the flu. This is a critical point, as early detection is key. However, as the virus progresses, some common symptoms may arise. These can include persistent fever, unexplained weight loss, swollen lymph nodes, fatigue, and skin rashes. Later stages of HIV infection can lead to more severe symptoms like recurring pneumonia, fungal infections, and certain types of cancers. It's essential to remember that these symptoms are not exclusive to HIV and could be indicative of other conditions. The key is to seek medical advice if you experience any persistent or concerning symptoms. HIV transmission occurs when certain bodily fluids from an infected person enter the bloodstream of an uninfected individual. The most common modes of transmission are unprotected sexual contact, sharing needles or syringes, and transmission from mother to child during pregnancy, childbirth, or breastfeeding. It's crucial to dispel myths and misconceptions. HIV cannot be transmitted through casual contact like hugging, shaking hands, sharing utensils, or mosquito bites. Understanding how HIV is and is not transmitted is paramount for effective prevention. The history of HIV dates back to the early 20th century, with its origins tracing back to chimpanzees in Central Africa. The virus is believed to have jumped to humans sometime in the early 1900s. However, it wasn't until the 1980s that HIV was identified as the cause of a mysterious illness that was affecting primarily gay men in the United States. This initial identification led to fear, discrimination, and a lack of understanding. It's important to acknowledge this history and how it shaped the global response to the epidemic. Before 1996, there was also a risk of contracting HIV from infected blood transfusions. However, rigorous blood screening procedures have virtually eliminated this risk in developed countries. Diagnosing HIV involves a simple blood test that detects the presence of HIV antibodies in the bloodstream. These antibodies are produced by the body's immune system in response to HIV infection. There are also rapid tests available that can provide results in as little as 20 minutes. Early diagnosis is vital as it allows individuals to access treatment and care early on, which can significantly improve their health outcomes and life expectancy. Knowing your status is empowering and allows you to make informed decisions about your health and well-being. While there's currently no cure for HIV, remarkable advances in treatment have transformed what was once a fatal diagnosis into a manageable chronic condition. Antiretroviral therapy, or ART, is a combination of medications that work by suppressing the replication of the virus in the body. ART helps to restore the immune system, reduce the risk of developing AIDS, and prevent transmission to others. The medications are highly effective, and with consistent adherence to treatment, people living with HIV can achieve and maintain an undetectable viral load, meaning the amount of virus in their blood is so low it cannot be detected by standard tests. Receiving an HIV diagnosis can be life-altering, but it's essential to remember that it doesn't define you. With the right medical care, support, and mindset, people with HIV can lead healthy, productive, and fulfilling lives. Living with HIV does require ongoing medical management, including regular checkups, blood tests, and adherence to medication. However, beyond the medical aspects, it's equally important to focus on mental health, emotional well-being, and building a strong support system. There are numerous resources available to help individuals navigate the challenges and live their best lives. HIV/AIDS remains a significant global health challenge, particularly in sub-Saharan Africa. According to the World Health Organization, an estimated 38 million people are currently living with HIV worldwide. The epidemic has had a devastating impact on individuals, families, and communities, particularly in resource-limited settings. However, there have been remarkable strides in global efforts to combat the epidemic. Increased access to testing, treatment, and prevention strategies has led to a significant decline in new infections and AIDS-related deaths. Yet, the fight is far from over, and continued investment in research, education, and access to care is crucial for ending the epidemic. Preventing HIV transmission requires a multi-pronged approach. One of the most effective strategies is consistent and correct condom use during sexual activity. Condoms act as a barrier, preventing the exchange of bodily fluids. Other preventative measures include pre-exposure prophylaxis or PrEP, a daily medication that can significantly reduce the risk of HIV infection in people at high risk, and post-exposure prophylaxis or PEP, a course of medication taken after a potential exposure to prevent infection. While a cure for HIV remains elusive, scientists around the world are tirelessly working towards this goal. Current research is exploring gene editing technologies like CRISPR, therapeutic vaccines that could potentially eliminate the virus from the body, and strategies to induce long-term remission, allowing individuals to live without medication. Although these advancements are promising, a cure is not imminent. However, the dedication and ingenuity of researchers provide hope for a future where HIV is no longer a global health threat. Early detection of HIV is crucial for timely treatment and better outcomes. It's important to be aware of the potential warning signs of early HIV infection. These can include fever, sore throat, swollen lymph nodes, skin rash, muscle and joint pain, headache, and fatigue. These symptoms are often mistaken for other common illnesses, but if you experience any of these symptoms, especially after a potential exposure to HIV, it's crucial to get tested as soon as possible. Early diagnosis can make a significant difference in managing the infection and preventing its progression. The World Health Organization, or WHO, plays a pivotal role in the global fight against HIV/AIDS. The organization sets global health standards, provides technical assistance to countries, and monitors the epidemic. One of the key initiatives of the WHO is the 90-90-90 targets, which aim to diagnose 90% of people living with HIV, provide ART to 90% of those diagnosed, and achieve viral suppression in 90% of those on treatment by 2020. Although these targets were not fully met, they demonstrate the commitment to ending the epidemic. HIV medications, known as antiretrovirals, work by stopping the virus from replicating in the body. There are different classes of antiretrovirals, each targeting a specific stage of the HIV life cycle. These medications are typically taken in combination, known as an HIV regimen, to effectively suppress the virus. Common HIV medications include integrase inhibitors, protease inhibitors, reverse transcriptase inhibitors, and entry inhibitors. The choice of medication regimen is individualized based on factors such as the patient's health status, viral load, potential side effects, and medication adherence. We've covered a lot of ground today, from understanding what HIV/AIDS is to exploring the latest advancements in treatment and prevention. The journey to ending the HIV/AIDS epidemic requires a collective effort. We must all do our part to reduce stigma, promote testing, and support those living with the virus. Remember, knowledge is power when it comes to HIV/AIDS. By staying informed and practicing safe behaviors, we can protect ourselves and our communities. Stay informed and stay safe. For more health updates, subscribe to our channel. Thank you for watching and take care.